Hi, I'm Dr. Wilfred Koon, Principal Dentist here at The Point Dental. Welcome back to the channel. In our last video, we talked about the traditional dentures versus all-on-4 and the key differences between those two options. Today, we are diving into another important topic that often comes up, which is overdentures versus all-on-4. If you have been researching ways to replace your missing teeth, you have probably heard of the terms snap-on dentures, implant-retained dentures, or firm-fitting dentures. All of these terms are essentially referring to the same thing. They're referring to overdentures. In these videos, I'm going to break it all down to you in very simple terms, what overdentures are, how they compare to all-on-4 dental implants, and the pros and cons of each. By the end of this video, hopefully, you have a much clearer picture of which solution might suit your needs the best. So, what are overdentures? Overdentures are essentially traditional full dentures that are modified to clip on or to snap onto 2 or 4 implants that are placed into your jaw. They are somewhere between traditional dentures and full-mouth dental implants. Compared to traditional dentures, they do feel more secure and you're not really relying on the suction or the denture glue to keep them in place. They are more stable when you're eating or speaking, and they're cheaper than full-mouth dental implants. But I always tell my patient this. It's important to know that they still come out from your mouth. You have to remove them every night to clean them. So while they might feel fixed during the day, they are not actually permanent teeth. And one thing a lot of patients don't expect is that overdentures still feel quite bulky. Just like how traditional dentures are, because they are supported by soft tissues as well as the implants. You still need a full denture base. That often means a palate that covers the roof of your mouth, which can affect how you taste food, how you speak, and even how confident you feel. Another important thing to know is that overdentures have a very good success rate for the lower jaw, which is about 98% success rate. However, it has a much higher failure rate for the upper jaw. This is because the upper jaw bone is a lot softer and it doesn't support those implants as good as the lower jaw, unless we actually place more implants together and also have all the implants connected together with a customized titanium bar. However, if you look at the additional cost of doing all of this, you're better off going for an all-on-4 full-mouth dental implants. So this is the reason why I would only recommend overdentures for the lower jaw. So why use implants at all if the teeth still have to come out? And that's the question that I hear a lot. The implants give overdentures retention. They help the denture stay in place better than suction or adhesive alone. But because of how the denture is designed, you can't permanently fix it in your mouth. It needs to be removed for proper cleaning and maintenance. So yes, you're going through the process of implant surgery and sometimes even bone grafting, but in the end, you're still wearing a denture that needs to be removed. Let's compare that to all-on-4. If you haven't seen my earlier video, here's a quick recap. All-on-4 is a technique where we place 4 implants without bone grafting and use them to support a thin, fixed set of teeth. These teeth don't come in and out. You brush them like your real teeth, you sleep with them in your mouth, and you eat with them, and they're just part of you. And because they are fixed to the implants and don't rely on your gums for support, they don't cover the roof of your mouth. So there's no bulky palate, just a thin, natural feeling set of teeth. That's something people really notice and like about all-on-4. I remember having one patient who had given up playing flute for more than 20 years because his dentures was too unstable and too uncomfortable for him to do so. The denture would always fall out whenever he tried to blow air out from his mouth. But after getting his all-on-4 done, he was so thrilled he could play again, and he even composed a piece of music on his flute for us as a thank you for giving him his hobby back.
I flew to say thanks to my dentist. Thank you very much.
And that's the kind of thing that is truly life-changing. And it's not just about function. With all-on-4, you can eat steak, you can bite into an apple, you can speak clearly without the fear of anything moving or clicking. So let's summarize the difference. Overdentures are essentially traditional dentures that clip onto 2 to 4 implants placed in your jaw. Compared to regular dentures, they feel much more secure. There's less slipping, and you don't have to rely on denture glue or suction to keep them in place. But it's important to also remember that overdentures are still removable. You need to take them out every night for proper cleaning. And because they are designed with a full denture base, they can feel quite bulky. And often, they cover the roof of your mouth, which can affect how you taste food, how you speak, and even how confident you are day to day. Overdentures work really well for the lower jaw, with a success rate of around 98%. But for the upper jaw, they are much less reliable, unless we add more implants and connect them together with a customized bar. And when you add up all these extra costs together, you're often better off going for a full All-on-4 treatment. All-on-4, on the other hand, uses 4 implants to support a thin, fixed set of teeth. These teeth stay in permanently. You brush them, you sleep with them, and you eat with them. Just like natural teeth. There's no palate coverage, there's no bulky plastic, and there's no compromise on the taste or speech. Functionally, All-on-4 is a game changer. You can enjoy all the food you love, from steak to apples, and you can get back the things that you thought you have lost, like playing musical instruments or speaking with total confidence. It's not just about teeth, it's about restoring the quality of your life. So in short, overdenture can be a great option if you're looking for a more affordable, secure denture. But if you want something that truly feels like your own teeth again, something that is fixed, natural, and life-changing, then All-on-4 is the gold standard. So if you're considering overdentures or All-on-4 dental implants, or you just want to learn more about them, feel free to reach out or leave your questions in the comments. We're always here to help you, and we love to support you on your journey. And if you found this video helpful, don't forget to subscribe to our YouTube channel or follow us on Facebook or Instagram for more tips, for more patient stories, and also behind the scenes of what we do here day to day. And thank you for watching, and remember, every smile has a story, and hopefully we'll be able to help you to create your story.